Uh, Typhoid fever. Typhoid fever is a systemic infection caused by the bacterium Salmonella enterica serotype typhi, that is a human-specific organism. It is an important cause of disease and mortality all over the world, especially in overcrowded and unsanitary areas, mainly in developing countries. As many One alarming issue in the emergence of resistant strains to antibiotics, mainly in Southeast Asia, Middle East, and Africa. Traditionally, typhoid fever was managed in the past by um, chloramphenicol, amoxicillin, and trimethoprim sulfamethoxazole, but high prevalence of resistant strains became disturbingly common. Nowadays, alternative antimicrobial agents are being used, such as third generation cephalosporin and um, quinolones, which became agents of choice. Unfortunately, there are some cases of multi-drug resistance salmonellosis even to these new agents, pointing to the importance of using cultures and sensitivities of this organism and adjusting treatment accordingly. The importance of the Waddell test is still controversial and confusing to many physicians because of its um, low yield and sensitivity and specificity. Other serology tests and a PCR test for proper diagnosis are still in the experimental phases. Prevention and control of typhoid. The most important factors in reducing the number of cases of salmonellosis are: 1. Improvement of water supplies; 2. Provision of effective sewage disposal; 3. Hygienic food preparation. In developed countries, most cases are due to travel to areas where the disease in endemic. Water for drinking should be boiled, and for food should be well cooked and stored. Mass immunization has been used in some areas with good outcomes. There are three types of vaccines. These vaccines are recommended for travelers to endemic areas, household contacts of typhoid carriers, and for laboratory workers handling salmonellosis. Also, immunization can be considered uh, during disaster and in refugee camps. The role of medical practitioners, especially those organized in Islamic medical organizations and professional um, unions, is indispensable in cooperation with health authorities. Their input in prevention and thereby therapy should involve education of the public as well as health workers. Their input in endemic areas, refugee camps, and during and after natural or man-made disasters is an ongoing duty and responsibility. Thanks for listening.